my incredibly beautiful patient, and today we are doing Morpheus 8, which is one of my favorite lasers to use. This is considered microneedling with radio frequency, and the great thing about this is that it's used to help with skin laxity and the face, the chin, the lower, and the neck as well. Now, I love Morpheus 8 as a combination treatment. So I just got done doing some other treatments on her for her skin laxity known as all therapy. All therapy is ultrasound energy that will help to tighten the skin, whereas Morpheus 8 is radio frequency energy. You'll see the little needles here, and these are gold-plated needles, 24. You guys take a look at that. And as it pulses, it delivers the radio frequency energy. All of that will help to tighten the skin. Now, as far as combination treatments, the first treatment I did on her was all therapy. Remember, that was ultrasound energy. And the great thing about all therapy is that I can treat at 2 different levels in the skin. I can treat at the muscle and the dermal layer. And when combining that with Morpheus 8, this radio frequency energy, you really see a lot of great improvement. Now, she's numb for a little bit, but she's still gonna feel just a little bit of it. But it's a relatively quick procedure. So I'm just gonna move along. I've already done almost a whole right side of her face. She's very, very brave because this is a little bit spicy. Anytime you're working with microneedling, it can be a little bit spicy. So I'm gonna do 1 pass to her full face. We'll eventually do 1 more pass, and then we're gonna do her neck. Perfect, and I'm gonna have you turn your face all the way to the right. Good.
And how many treatments does a person need to see results?
Now, I always recommend that you do Morpheus 8 as a combination treatment. You're definitely going to need more than 1. What I recommend is that you get a series of 3, 4 to 6 weeks apart, and then you do it as maintenance every 2 to 3 months to really help with that tightening. If you do it when you have a little bit of mild skin laxity, what you're doing is pretty much adding collagen to the collagen bank, and that'll help you stay nice and young as far as keeping your skin very tight. Now, if you really want maximum results, combine this with another laser, such as all therapy or thermage, and you'll really get kind of a big bang for your bucks. But I really enjoy this because it's microneedling and radio frequency. It's very similar to Fractora, but very different in kind of what it addresses. Remember, Fractora is really addressing more so acne, scarring, or textural issues, and Morpheus 8 is really addressing skin laxity.
Anisha, is this safe for everybody?
Yes, that's another great thing about this laser. Now, you know, I love when a laser can cater to all skin tones. So the great thing about this is that you can use this on all skin tones. Now, because needles are gold plate, you're not really going to cause any type of hyperpigmentation, even if you use it on my skin tone, which is a Fitzpatrick 6. You can see she has turning a little bit red, maybe a tiny bit of pinpoint bleeding, but that's about it. I'm going to go back and do another pass on the right side of her face.
Can you tell me about what her downtime would be like?
Now, the downtime for this is anywhere from 2 to 3 days. And really with good skincare, I would knock that down from 2 to 3 days to 1 to 2 days. And by downtime, really all I mean is that she's going to have a little bit of redness. You can see the little bit of pinpoint bleeding. And in the next few days, her pores will be open, or these little holes that we're creating will be open. They'll start to close. And with the appropriate skincare to help exfoliate, I mean, this is all going to be gone really in 1 to 2 days.
Is this safe for people with broken capillaries or vein disease?
It really depends. What do you mean by broken capillary vein disease?
So say spider veins or varicose veins?
Yeah, you can do, if you have spider veins or varicose veins, you can use this over it. We can do this treatment almost anywhere. Right now I'm using it on her face and on her neck, but we can also do this on any body part, on the abdomen, behind the thighs. I've done it on several body parts to help with a little bit of skin laxity. And all the way to the left one more time. Perfect, perfect, perfect. So this is the microneedling with radio frequency, used to help with mild skin laxity, but great in combination with other treatments to really help with overall rejuvenation, keeping you nice and young. You can do this no matter really what age group you're in. Doing it while you're younger just helps you kind of just age really nicely. When you're a little bit older, you have a little bit more skin laxity. Combining this, either using it by itself is great, or combining this with something like oil therapy or thermage is a really great combination treatment to help with the skin laxity, especially if you're not ready for surgery or anything like that.
All right, Nisha, so I have some questions for you. Someone's asking, what would be the reason for a breakout after a chemical peel?
Oh, that's really going to depend. I would love to answer your question directly, but a part of that's going to be dependent on what chemical peel it is, what your hypersensitivities are. If you really want a good answer, I would love to do a consultation with you. We could do a virtual consultation with myself or one of our treatment coordinators here, and I would love to kind of walk you through why you may have had that reaction after doing the chemical peel. So I'm going to have, after this, we're going to do plasma pen.
So asking how much and where are we located, guys? To find out how much, and you definitely need to talk about what areas you need treated, and that treatment depends on the areas. So you need to get a consultation with us. You can do that by sending us a DM with your full name, email, and phone number. Or you can send us an email to jasonmd.com or on emercosmetics.com. You can get a virtual consultation with us. We are located in West Hollywood, California. We do make trips to the East Coast, so if you are out there, get on a list and we'll get you in.
So right now we're treating her neck. And remember, this is MORPHEUS8. This is microneedling with radio frequency energy. And this is used for skin laxity. Right now I'm using it on her face and her neck. But remember, you can use this on almost any body area that you're interested in tightening the skin.
Guys, her skin does look red because that area has been treated already with the microneedling and radio frequency. You can see over here the needles going in.
So she's going to turn a little bit red afterwards. That redness will go away. She's going to have a little bit of pinpoint bleeding. All of that will stop. And then with the great skincare that she's going to be on, she's going to have really maybe a downtime of maybe 1 to 2 days, max around 3 days for most people. I'm going to have you raise your chin up a little bit more. And
what is her skincare going to be like afterwards?
So right now, as I'm doing the microneedling radio frequency, I'm creating these little holes in her skin. And of course, her body will want to kind of regenerate and resurface because of that. Now, part of that is she's gonna need a really great exfoliant, and she has all of her appropriate skincare. So a really gentle face wash. You definitely want, some of the products I recommend from the line that Dr. Emer has is something called AOXC, which is your vitamin C, Hyla B, because of course with these little holes, your skin may feel a little bit drier. And then something like a Skinzyme mask.
Someone's asking, how are the needles sterilized?
So these are new needles. Everyone gets their own pack. So this was straight out of the pack. Once she's done her treatment, it goes in the trash. So these needles don't actually need to be sterilized in between patients because you're going to get your own set.
So I'm asking, how deep are we going and pertain to our settings? I don't know if I had to tell them that.
No, little tricksters. Everyone's going to be so different, guys. It depends on the body part that we're treating. It depends on what area. We're going to have the appropriate settings that's going to give you the results that you want. And of course, that's appropriate for the body area. All right, so you can see I've treated right now her neck, her submental underneath this part, and her face as well. I'm going to have you raise your chin up. I kind of want everyone to see. This is what you're going to see. She has a little bit of swelling or where the needle pokes were. All of that will go down within the next few hours. She doesn't really have much pinpoint bleeding on her neck, a little bit on her chin, which is very, very normal. All of what she's experiencing will go down within the next few days. Remember, this is going to be a really great treatment because this is her first set of MORPHEUS8, but she's going to come back and do her recommended treatment, which is every 4 to 6 weeks. And it's for her to see maximum improvements. You tend to see the best results 3 months after your last treatment. And if you really want great results, I recommend you combine this with other procedures. Ones like oil therapy, thermage. Those are really great to kind of assist with the skin tightening. They work a little bit differently, but they all work together to kind of give you the maximum results.
Okay, Nisha, let's go through the question section for you guys. How long does this treatment take?
So I think we just did this start to finish. It may have taken what?
We've been on live about 10 minutes now. So it's not a long treatment.
It's very, very quick treatment, guys. And this is face and neck in about 10 minutes.
Why are you doing so many needles?
So it comes in 24 pens. It's for, I'll show you guys. 24 pens. And she's just about done with all of her treatment.
So I'm asking, why can't you tell us your settings?
Oh, you guys are such little tricksters.
No, that's our secrets, guys.
All right, so she's now done with all of her MORPHEUS8 treatment. We're gonna go ahead and start her plasma pen. Of course, it's gonna give her a lot of skin tightening underneath the eye and around the eye area. She's already done her other treatment. We completed that already, and now she's looking great. You're gonna gradually, or what you're gonna gradually see is she's gonna get a little bit of tightening just from the microneedling, but over the course of the next few weeks, 3 months after her last treatment, she has 2 more treatments coming up. She's gonna see the maximum benefits of tightening to her neck and her lower face. The great thing is, like I mentioned before, she's combining this with all therapy, which is another great laser using ultrasound energy to help tighten the skin. And that combination of treatments is really going to give her the best results. Now, you guys know I love to combine treatments. Sometimes I think that's the best way to get all of the results that you want. And being consistent in your skincare routine, which she already has. She's been in contact with our skincare specialist. She's been doing all of her recommended treatments. Her skin is already looking really, really great. She's going to have a lot of great improvement from what she's already done. Once again, the downtime is anywhere between 2 to 3 days. It really just depends on if you're making sure you're on the good skincare, you're doing everything that you need to do. But other than that, she looks good. And I'll be sure to see you guys when we're doing her plasma pen.
All right, guys, stay tuned. We are going to do her plasma pen next. Really interesting to watch. We're going to help disappear these dark circles, and we're going to get rid of some fine lines and wrinkles as well. So stay tuned for that. That's up next with Dr. Emer and Nisha.
All right, guys. See you next time. Bye.